Okay, now we need to move on to the next presentation, which Dr. Hyacinthe Victor Hyacinthe Guigma, who is an expert in veterinary public health, trained in service applied veterinary epidemiology, and he is a former director of veterinary services of Burkina Faso, and now he joined the World Organization for Animal Health based regional office based in Bamako. Is really leading the both Sursi project, and is also involved in IHR, PVS, National Bridging Workshop, and other One Health activity. He will chair this session, implementing joint risk communication. Over to you, Dr. Hyacinthe, please. Thank you.
Thank you, Dr. Tieble. I will speak in French because my English level is low. OK. OK, bonjour tout le monde. C'est vraiment un plaisir pour moi de présider cette quatrième session qui est consacrée à la mise en œuvre des stratégies conjointes de communication dans le contexte de zoonoses. Donc, c'est vraiment un réel plaisir pour moi et je vais présider cette session avec d'éminents experts qui sont au nombre de 3. Et nous allons avoir 3 présentations durant cette session. La première présentation sera faite par le docteur Rodrigue Barry. Il est responsable technique de la communication des risques au sein du centre d'urgence à Dakar. Et il a travaillé en tant que responsable de la communication et du plaidoyer dans le projet vaccin méningite. Et il est également journaliste au niveau du Burkina Faso. Donc, c'est le premier panéliste que nous allions écouter. Et le deuxième, il s'agit du docteur Mohamed Nour. Il est consultant en médecine communautaire et il travaille pour le développement de la protection de la santé et du contrôle des maladies transmissibles au niveau du ministère de la Santé publique du Qatar. Et il a été également responsable des engagements communautaires dans le cadre de la réponse de la COVID-19 au Qatar. Et Dr Nour a consacré la majeure partie de ses 18 années d'expérience au niveau du contrôle des épidémies et des maladies infectieuses et également à l'engagement communautaire en situation de risque. Le troisième panéliste, il s'agit d'une dame, c'est Dr Catherine Bertrand-Ferrandis. Elle est vétérinaire de formation. Dr Catherine travaille depuis 15 ans dans le domaine de la santé publique, de la communication et des risques et du renforcement des capacités. Elle a été le responsable du département de communication à l'Organisation mondiale de la santé animale de 2013 à 2019. De communication. Elle soutient l'OMS dans la réponse de la COVID-19 en développement. Ainsi dit, voici le décor est campé et comme vous le saviez, depuis hier, nous avions vu les principes de communication des risques et durant cette session, nous allons voir quels mécanismes mettre en œuvre pour effectivement communiquer et avoir passer le bon message durant une situation de zoonose. Donc, sans plus tarder, je vais donner la parole au docteur Rodrigue Barry pour sa communication. Donc, docteur Barry, vous avez la parole.
Okay. Good evening, where you are. I'm actually in Algeria for a training session, and it's an opportunity for me to share how we've found on the ground the observation of WHO, because as you know, WHO is not implementing risk communication, but we are giving support to countries to implement risk communication on the good way. I've sent my presentation for maybe if Adam can share it for me. Yes. Thank you, Adam or Scotty. This is the first one. I was just saying that WHO is not implementing itself the RCCE approach, but we are giving support to different countries. And I will share what we observe on the ground. Before implementing, the first thing to know is how it works. If you don't understand well how risk communication and community engagement works, you will do wrong on the ground as a responder or another member of different pillars working different during the outbreaks. Next. Let me start by something simple. What is the risk and what is the danger? The risk, you are driving your car on the traffic and you see different signs. This is the blue one, it's a hump. Next. And you have the second one, who is the red one. Using the different colors, the blue one means the risk and the red one is the danger. Risk communication means to talk about the risk for people to avoid being in the danger. If you understand this, it is so simple. Next. We are talking about risk communication because it's something as known as an essential component. Effective risk communication is like coordination, is like surveillance, is like everything during the response. And it's one of the essential knowledge to be got by everyone. Even you are a medical doctor, you are even a scientist at different level, it's important and it is recommended for everyone who is supposed to be involved during an outbreak response to have the knowledge of risk communication to be implemented with what he learned during his studies. Next. It's important to know that everything's are changing and things are changing on the ground. You can go next for the three ones. The first one, you see there are two colors, red and green. What is recommended as risk communications approach is to help people to create receptive mindset, not only as we were doing in the last past, saying you have to do this, you have to do this, or only using messages to change as communication channels. First thing to do is to create receptive mindset. The second one is to create two ways communication dialogue. It means that using only messages can't change the situation. And the third one is to help people to understand the different advices. You want people to wash their hands, you ask people to do this or to do this. Imagine the environment. If there is no enough water to drink, did people will wash their hands? So you need to give them support so they will understand exactly what you are asking them to do. This is what we are doing now, not only using messages, posters, radio, etc., but after this, you need to help people to open their mind to dialogue so you can get feedback and then you can facilitate the understanding of all the advices. Next. Risk communication means four things. Before talking about trust, you need to know the values. You can't intervene into a community without knowing what are the values of this community. And if you know the values, you know things to do and things not to be done. And the second thing is using people that are credible on the ground. We used to say, if you want to enter into the community, you need to work with a chief. But you need before using the chief as a stakeholder or channel to reach the community, you need to know if the person is credible. If he's not credible, don't waste your time. look for people who are credible, because as we say in communication, the message is not only the important thing. The messenger is more important than the message. And you need to have technical information. You can't convince people without technical content and technical background. Is the reason why you need to have those things before thinking about trust. Successful risk communication necessarily generate trust. Without trust, impossible to work in the field. Next. Risk communication means 5 domains. As a risk communication senior officer based in Senegal, Dakar, in Dakar Emergency Hub, we noticed that no different countries knows exactly what are the 5 domains. Let us present the 5 domains. The first one is to put in place a system. Without a system in place, it's impossible to have risk communication to be organized on the ground. If you ask questions to the countries, they said, yes, we have one person as a director and the people are not trained. There is no plan. The plan is not uh, funded, and there is no simulation made on the ground before the outbreak become a reality. Next. You can roll out the 5. We need during risk communication and emergency situation to have internal coordination and partner risk communication for emergency risk communication pillar in place, because there are different stakeholders coming in, there are different partners. You need to have a good coordination. If not, you'll have different numbers put on the radio, on the website, etc., and things will be difficult to be coordinated. What we saw on the ground after analyzing about 22 countries from West and Central Africa is that the countries are already expert in public communication. Public communication means using media, using posters, etc., etc. And about 60% of the efforts are on public communication. But what we are expecting the countries to do for risk communication is to put more investment in community engagement. Is the reason why this box is in red. People need to invest more in community engagement because communities are affected. People are dying. If you only made public communication without giving support to those who are affected, you will lose trust and people will not follow you. And the second great issue to be invest is perception, rumors, and fake news management. If the countries can invest more on community engagement and rumor management, I think the numbers will be different and the approach will be well implemented. Next. I want just to put the focus on community engagement because community engagement is key during outbreaks and different situation, epidemic situation. The first thing is to communicate in a timely manner and promote transparency. If you are not transparent with the community, they will just look at you, they will clap their hand, but they will not trust in you. It's important as risk communication officers or responders to listen and understand what are the concerns of the community before planning and then realizing things on the ground. And you need to be fair with the community because people are suffering. All of those 5 items can lead to building trust. Without trust, don't think things will move smoothly on the ground. Next thing about the community engagement. Next, please. Yes, you need to take into account the level of the education of the community. And we need to use the old languages or dialect. I was in DRC during the outbreak, Ebola outbreak, 2019 and 2018. What we saw You know, we were in North Kivu. North Kivu they are speaking Swahili. And the majority of Congo, they are speaking, as in Kinshasa, is Lingala. What we saw on the ground, people are producing posters, and they brought the poster written in Lingala to North Kivu, where people are not speaking Lingala, they are speaking Swahili. So it's important to take into account the level of education, the languages, even the dialect, and to choose the trusted stakeholders and the channels the community are trusted in or what they are using every day. Don't create new channels, don't create new platform. If not, you will lose people and they will not be trusted. Next. During outbreak, there are 3 steps to be followed. The first one, before the outbreak, we are losing this opportunity and we need to invest at national level with all the different partners. We need to take into account the healthcare workers because they are those who will go on the ground, and we need as third target group to work with the community. Work with the community before give you an opportunity to construct trust and build the trust before the event occurs. The second thing, I think all the countries are very effective during outbreak, not because they are strong, but because there are different stakeholders coming to give support. And the last thing, where we are weak is the evaluation after. Once the outbreak is finished, people are going back to the usual business. They forget to continue to communicate with the community. It's important to know because the community, they are still there. They are still suffering. When you go back and you leave them with a problem, let's be sure, like we saw in Guinea during the 2014 and 2015 epidemics, there will be new cases because when you let the community inside of their own problem, the situation will go to be worse. RCC is essential at all level of intervention. RCC principle is to build trust. Without trust, nothing can be done. Even you are an expert, even you are the Minister of Health, nothing will appear. Next. We need also during outbreaks or different situations to manage rumor. You know, there are the traditional media like radio and TV, etc. We need to put inside a system of monitoring. And we need also to monitor the community feedback and to put it inside our response. And we also need to monitor the social media because social media today are key, and we need to be participant of this big flow of information to put inside the good communication and to give support to the community. Next. I will finish with this slide. This is something really important, real-time exchange communication or information. What we saw on the ground during, I checked just this example related to COVID. People are producing messages, posters, and during 2 years, it's exactly the same posters and the same messages that are put into the radio and into the TV. That means they don't understand what is risk communication. Risk communication is real-time exchange. What you say this morning will be different in the afternoon because the outbreak is evolving. And this is important for everyone to understand. If you visit a country and the poster is still the same during 1 year, let's know that we are not dealing with risk communication and they will lose trust because I will finish with the next one. Risk communication means, next, the first thing is to build trust. The second thing is to take perception into account. If you don't understand the perception of a community, you will produce messages, you'll implement activities that are still weak. They will not give result. And the third one is to be empathic. If you are not empathic, you need to revise your position because people are dying, people are affected. You need to think about empathy. If it was me living in this situation, what will be my own life? It will be different. And the last thing is related to empowerment. We need to give power to the community because the community is at the beginning and at the end of everything. Thank you for your listening. Thanks.
Merci bien, Dr. Barry, pour cette excellente présentation. Je ne sais pas si je l'avais dit lors de l'introduction, mais Dr. Barry est journaliste, ce qui se fait ressentir à travers cette présentation, parce que les termes sont très bien utilisés et bien clairs. Donc, Dr. Barry est revenu sur l'importance de choisir avec qui communiquer. Donc, il faut vraiment choisir les personnes crédibles et également choisir les bonnes personnes pour transmettre l'information. Donc, c'est vraiment un élément capital qu'il faut tenir en compte en communiquant ou en situation de pandémie. Également, il a parlé aussi de la langue. Il faut effectivement utiliser la langue, je dirais, vernaculaire, la langue de la localité pour pouvoir bien communiquer avec les communautés qui sont vraiment concernées par la situation. Et au lieu de créer d'autres canaux de communication, certes, il y a déjà des canaux existants, donc on peut facilement s'appuyer sur ces mêmes canaux pour diffuser les informations qu'on veut adresser à la communauté. Et il a également évoqué l'importance des réseaux sociaux présentement qui constituent vraiment un facteur, je dirais, important en termes de communication parce que tout le monde a accès à ces réseaux sociaux. Donc, il faut vraiment s'assurer que c'est la vraie information qui est véhiculée dans ces réseaux sociaux. Vraiment, merci infiniment, Dr. Barry, pour cette présentation qui est vraiment claire et vraiment succinct. Donc, nous allons passer maintenant à la deuxième présentation qui sera faite par un docteur Mohamed Nour. Voilà, donc, docteur Nour, vous avez la parole.
Yeah, thank you very much, the organizers, and thank you everybody for this attendance of this very critical session. It comes really at a time, and thank you for Dr. Barry because he has made it extremely, easy for me because he has laid a very nice grounds for my presentation. Let me now share my slides with you, and here we go. I'm going to skip the introductory slides about the risk communication, but as you know now, the risk communication, is one of the pillars that needed to handle the different threats that we are having. As you know now, we live in a world where the risk for having the emerging and re-emerging threats is very high, and the speed by which people transported and travel from place to place, and the climate change and the interaction with each other, and the migration, and also the urbanization and the globalization and the antimicrobial resistance. These are all kind of factors that shape our world today. And this is bring to the play the importance of IHR 2005 capacities, which requested the countries to build competencies for surveillance, for having the capability to detect timely and to initiate response to the detected threats, and also to mount the containment measures across borders and call for international help whenever required, and also staffing the hospitals and healthcare facilities with the appropriate assets and people, and also have the diagnostic capacities in place and communicate these findings and the measures to the communication. And the communication involves also the intervention measures like vaccination, like the distancing and other social measures that we have seen in COVID. So I'm going to skip these because the speakers before me have well laid the ground about them and explained them. But I would like to stay here a little because I have now a great impression, I can say, about that risk communication really is about, the experts and the decision makers, then the communities. Why? Because regardless of the source from where the threat, which is, or the risk, in another terms, a bad thing that might happen, okay, it will end as a rumor or as some events reported through the appropriate channels to people who can do action about them. It will engage the subject matter experts to discuss and to assess how likely it is for a risk situation to happen and what are the consequences. And they are going to employ the science and the literature in order to bring answers, okay? So it's all about the competencies of the subject matter experts in order to have a reliable and trustworthy judgment about the situation and the expectations. And they are going to take what they think to the decision makers, and then the decision makers will decide whether to step forward and to share this situation and the likelihood of something bad to happen to the stakeholders and large to the public or not, okay? And that's really the very critical phase where Dr. Yahya, who has delivered his presentation prior to mine, has mentioned that this is the opportunity that we always tend to overlook and miss in employing the science and giving the chance for the people to act upon a narrow time frame and a very hectic situation. This is the time where there's an overwhelming uncertainty, not just about the risk that might happen, but also about the outcome of the recommended action down the road. So all has started with a news release by BBC on 12th September 2012 and 24th by a news coming and saying new SARS-like coronavirus identified by UK officials. And that was for a Qatari national, who had developed extraordinary respiratory symptoms, and they have subjected him in the very reputable hospital here in Qatar to the protocol for managing such cases. But over a period of week, the case was just deteriorating, and the plan of management was not paying off. So the relative decided to take their patient out of the country to be treated in London, and there, they managed through their diagnostic capacity that they had to isolate what has been known at that time as the novel virus or SARS-like coronavirus, and emphasize with me that SARS-like because it brings back to everybody's attention what SARS was, what has happened in 2002 and 2003, and was a kind of killing disease. Most of the people who have developed the symptoms eventually died, and the mortality was like 30%. So 1 in 3 will end up dead because of the SARS. So that was a kind of scary to start with. And that has brought a very immense and a timely action by the officials in the Ministry of Health here in Qatar, because they have to review with the hospital officials what happened with that very case and why it was traveling and why here, because here the system is really one of the best global wide, and that was testimony from some of the accredited organizations about this. So that was not giving a good image for the country. So that was a kind of reputation and risk, if you would say. So they have done a homework of identifying whether similar cases are in the hospital or not, and say publicly in the first conference that they have done for this, no other cases are there. So at that time, there was no any talk about from where that person might have developed or have contracted the infection. But over a period of 7 weeks, one press conference and like 2 press statements and only one single case, over 17 press stories were released about that case, because it has captured the attention of the media. And now the people are having different stories, because media in such times try to fill the vacuum and tell what could be next, who are at risk. So these are all featuring the very critical phase of the emerging threat, establishing foot in a community, whether in cases failing and dying, or in seeing extraordinary thing happen in cattle community or anything like that. So this is overwhelming situation of uncertainty that requires people to bring answers where they lack the tools for that. And here we have 2 countries with the capacity to diagnose and to bring answers in time, and countries without. So here that brings to the talk that there are like 5 barriers to sharing data and information. These are like political or ethical or administrative, regulatory, or a kind of logistical issues. And we have seen that in SARS, where some of the countries affected denied of sharing the information and denying of sharing the samples, because down the road there might be credit. And here we'll come to the talk why I give you to the credit while I can take it my own. And we all know about the very how it all started by one of the lab technicians identifying the MERS in a sample that ended up in his lab. And when he declared the new kind of discovery, he was repatriated to his home country, because that was against the political will of the leaders in that very country. But here, this is the turning point when a second case reported by the thorough epidemiological investigation. They have found that this case had, visited his camel farm before he developed the symptoms shortly afterwards. So the team headed to the farm. But in order to collect samples from the place, after consultation with the WHO, CDC, Netherlands, Erasmus Medical Institute, it was decided that a joint team to visit the camel farm and to collect samples from all the types of animals, domestic animals that happened to be in place. So there were like 5 or 7 types of animals, you can name them. But the sample that tested positive for that was the camels, and that was very, very, very hard to believe, because everybody perceived the camels to be a blessing animal and to be used for pharmaceutical kind of uses. Urine, the urine of the camels is being excessively used, and it's a kind of very beloved and precious and used in business and recreational activities. There are here businesses all built on camels. So it is not very easy to go out to the public and to say them that we can blame the camels for something that is killing. And for, unfortunately or fortunately, I don't know how to say it, the camels did not show any symptoms and they are not ill for that kind of virus, so they are host. So that also was a kind of tragic for the public health officials, because in order to bring the teams together to do their part, you are speaking about competencies. Yes.
Il ne vous reste plus beaucoup de temps.
Yes. Okay. So I'll be short here by telling just it was very difficult situation for the public health officials as well as for the veterinarians to reach out to conclusion about how to handle this. But after discussion with each other and the public denial about the possibility of having the risk and the poor risk perception, not only among the public, but among some of the officials who also have, conflict of interest. We ended up by doing risk assessment in all the camel population, and the evidence about the camels being the host and none of the other species to be responsible for transmission of the virus were ruled out. That was, that has fostered, if you wish, the evidence about the camel playing a role. And that has placed more agenda for our colleagues in the animal health department to team up with the medical and public health officials. And they have together created a One Health approach of going in public together and sharing the same message with the publics. I'm going to stop here, and I'll be waiting for the questions. And sorry if I've taken more time. Thank you.
Merci bien, Dr Nour. Non, je précise que vous êtes dans le temps. Vous êtes dans le temps, vous n'avez pas débordé. OK, merci bien pour cette présentation. Et Dr Nour est revenu en tout cas sur la communication qu'on doit avoir en moment de crise, et également les insuffisances de communication. Il a relevé quelques insuffisances que certains médias ont eues pendant des crises sanitaires, et également des exemples de cas de gestion impliquant le secteur de la santé animale, mais également le secteur de la santé humaine. Vraiment, c'est de très bels exemples qui donnent déjà comment cette collaboration doit être menée au moment de gestion des crises liées aux zoonoses. Donc, nous allons maintenant passer à notre dernière présentation. Elle sera faite par le docteur Catherine Bertrand-Ferrandis sur la mise en œuvre des stratégies de communication. Donc, docteur Catherine, à vous la parole. Docteur Catherine, votre micro est fermé.
Thank you. Je disais bonjour et merci pour l'introduction et que j'allais and I'm now on. So let me share my presentation. Thank you very much. Sorry. Hop. Sorry. So it's not easy to be the last one speaking with such great experts before me, but it's great because they shaped the topic. And as explained by Hyacinthe earlier, so I'm a veterinarian by training, and I'm also a journalist. I've been working for 15 years in risk communication in public health, both on the animal health side and on the human health side, and a little bit about environment too, because I was working with the former OIE and now WOAH, you will correct me, Hyacinthe, if it's not the way to say it. So I've seen the different parts and how you can try to have risk communication strategies that are working in the field. So I won't repeat what my colleague said before, but I will give you 4 tips that I've learned in my career. Because it's a very particular area, One Health. You have to deal with multiple stakeholders, And partners, you need to coordinate with them, to negotiate with them, and to ensure that when you communicate, you have consistency, as explained by, I won't repeat the importance about the consistency of the communication we are doing on this kind of zoonotic topics. And you need to address several types, multiple types of audiences with different sectorial objectives, with different drivers, different barriers, and different contexts. When you speak about a nurse or a farmer, you can understand that it's not the same context, economical, social context. And you have multiple platforms available online and offline where people talk and discuss and exchange information. All this with, most of the time, not a lot of human or financial resources. So I now have 8 minutes for tips. And my first one will be to connect. It was said by some of our experts, and I think that Dr. Barry said it very well, that you need to make sure that you connect in peacetime with your stakeholders and with your audience. I will try to map it with stakeholders on one side and audience on the other side, final audience of your communication. Map your stakeholders network today, the one you need to coordinate with in order to ensure that you will have a consistency of messages, or at least communications, and you will have a coordination expected when you will need to address the crisis, or even before, when you will need to communicate on a risk, zoonotic risk in the ground. So it's something that we always think that, yes, I map my stakeholders, no problem, I know who they are, etc. But the real mapping, the real sitting and making sure that you have everybody on board, it's not something that we do easily. So if it's not clear for you, who are your connections, who are your stakeholders, please really sit and do it, because you will gain time and you connect with them. You will be able to build this coordination in peacetime, because it's not when the crisis is coming that you will be able to do it. We talked about colleagues before, Barry, for example, or even in the previous session, trust was really emphasized as really one of the biggest pieces that we need for risk communication and efficient risk communication. And this trust, you need to have to win it also with your stakeholders, not only with your audience, but also with your different stakeholders, because again, One Health is an area where you have different objectives, different topics to deal with, different environments in your different organizations. So really connecting with them, knowing them in advance is very important. And I will show you one example of training you can do together, or work you can do together. But remember that with your stakeholders, your different stakeholders from different sectors, really training together on something, on a new methodology, for example. If you are not an expert of communication, training on a methodology of risk communication is something that will help you to work together tomorrow, because you will build common language, you will build common experiences together also by training, because it's always fun to train, and you will better understand each other in the future. When I was at the OIE, I used to work with veterinary services, and we trained actually veterinary services with the same methodology than WHO was using. And this connection between the different sectors, the fact that they were using the same language when talking about risk communication, really helped in the everyday work in the One Health sector. And also, let's think about connection. Think outside of the box when it comes to audience, or even to representations of audience. We have different sectors, but some of the networks, unusual networks, can be very useful. It's places where, even if you don't have the same objective when it comes to animal health or human health or environment, it's networks where people are together. like parenthood or gardening or this kind of common interests that are human common interests that are outside of your health or sector, and that can help you to bring people together and to connect with them and to engage with them in a different way than the one that we are most of the time using. Second, listen. Listen, we discussed about it, the other participants, experts mentioned it before. I just want to re-emphasize something. Today, we, and the Nigeria colleague mentioned it, today there is too much information around, there is a lot of noise, people receive information from lots of different, so from friends, from colleagues, from families, from news, from groups, from lots of different channels, on different platforms, with lots of different level of quality of the information. It could be accurate but outdated. It could be misinformation, or it could be disinformation, even so intended with to cause harm, and it can impact the trust in authorities and reinforce cognitive bias, because you are always looking for something that you know or that reassure you. So this is all part of what we call infodemic today, the fact that there is too much information, and this overload of information does not allow you to grab and to see the adequate information. So in this context, that I just wanted to remind you, one of the biggest advice that I will give you today is that you have 2 ears and 2 eyes and only 1 mouth. So really, it was said before, but we really need to listen more, and to listen in a very constant way, because it's changing very fast, and the discussion, the narratives are moving a lot. So you need to have a system in place, as was said by Dr. Barry, to be able to monitor and to listen to your communities and to your different sectors representatives. Why? Because you need to be sure that you know what are their questions, their concerns, and their void of information. Because in this place where there is a gap of information, it's where the rumors of the misinformation will grow and will plant roots. And once the rumor is outside, it's very complicated to debunk it. So it's an attempt to pre-debunk it when you know where there is a gap. Or when you detect at the beginning, when you detect a concern, you can address it so that there's no time for the rumor to spread and to take the space. And our colleague from Qatar explained what can happen when there is a void of information in the public. Remember also that it's not only online. Social media are very important today, and they are very various. But you really need to make sure that you know also what is happening offline, because there is no difference today. Everything is intertwined. So you really need to make sure to listen also your communities offline. And for this, you can use CAP surveys, like explained by Catherine at the beginning of the previous session. But you also need to make sure that you can have rapid community assessment tools available, so that you can rapidly develop insights and inform your response when there is a crisis. CAP surveys are perfect in peacetime to assess, to have basic knowledge. Different drivers, different barriers. I think it's something that you are clear about. We are talking about One Health. Farmers and nurses, to take the same examples, do not have the same drivers and barriers and the same context. So you really need, again, to tailor to understand who they are and what they need, and to tailor your messages, your tools, your channels, and the way you interact with them in order to make sure that you will address their concerns. And I will show you one campaign later that was made in this spirit. And lastly, so different drivers, different barriers, but also not the same experiences of internet. You need to keep in mind that social media's internet is different for each of us. I don't have the same internet than you, and even if we were living in the same house, if we have different device, we would have a different experience, because algorithms show us different things based on our personal data and our behavior on the net. So keep this in your mind. And do not fear to produce materials that can be reshuffled, repackaged by people, that they can use them without branding or anything, because it's when they will take your messages and put it in their own channels and their own way to speak, that they will be able to share it with their closed ones, with their families that will trust this message. So do not fear to have materials that are repackaged. 3, involve, and it's where I'm coming back to my notion of working together, training together. We talked about community engagement. I won't repeat that, but I will just show you one of the example of the methods that I recommend you to use. I hope you are seeing all the screen. I added the references at the end. This is a design thinking process diagram. It's very well explained on their website, and the interest of this diagram and process is that it's really helping to bring together the different participants of a situation. And when you need to communicate on zoonotic diseases, you need to have different representatives from different sectors at the table and in the field with the people in the village or in the city or whatever the place you want to address the issue. But you put them around the table, and with them you can, with this iterative process, you can ideate and prototype solutions that you test and you assess, so that you can inform maybe a revision of your prototype or a revision of your strategy. And it's really, really, really one of the best way to make sure that the humans are at the center of your strategy. And it's not only concepts, but it's really what they are waiting for. And it's also a way to involve them in the success of the campaign, because people who are integrated in building with you the tools, the strategy, the solutions, will want to have them succeed, so they will push for it, and they will also be your ambassadors. Again, you have references at the end of my presentation. I don't know exactly about the timing, so I will move to the next one. My last advice is have fun, and I'm sure that this one nobody told it before, but have fun is very important, because humor and laugh is one of the universal emotion and language, and it has been demonstrated, for example, that when you use it with students, it improves their performance, because it's attracting and sustaining the attention, it's reducing the anxiety, and you know that anxiety is very high during a crisis. Enhancing participation and increasing motivation. So I'm not saying that we have fun topics. Most of the time our topics are really serious ones. But when I mean that we need to have fun, is that we need to have fun when we are working with our stakeholders, when we are exercising, when we are creating simulation exercise or training together, in order to have this notion of creation of community, because it brings you together and it helps you to share something that you will have in common. Again, common language, common way to work together, common references. It's very important. In the middle of this screen, you can see the campaign on antimicrobial resistance that we developed at the OIE, I think it was 5 years or 6 years ago. And you can see that it's fun, because it's a chicken pointing the audience. So it's kind of fun, and it attracts the attention, and from the animal health sector, but also from the other sectors. And this campaign was really developed targeted to farmers and to animal health sector. It was developed in order to address their concerns, and not saying, as the others campaigns that were saying you need to use less antimicrobials in animals to save humans. No, it was here animals talking to the farmers saying, we need you, because we need to be able to use antimicrobials tomorrow to continue to be treated with antimicrobials when we need them. So it was really the other side, and it was targeted to the adequate audience. Do not fear to tailor your message to your audience. It's difficult in One Health because you have multiple topics and different people to address to, but you can do it, and fun is helping. That's all. I hope I was not too long. You will tell me. Here on this screen, you have, I think we will circulate the slides. You have different sources where you can discover more about risk communication methodology that you can use, but the one I mentioned earlier that is common to WHO and so WOHA. You have references on infodemic management that we mentioned, but we did not go in detail, so you can click and have more information about it. More information about design thinking process, social listening and integrated analysis in order to have a quick and rapid assessment of the situation in the field, and some sources also to see how to address health misinformation. And thank you.
Merci, Dr. Catherine, pour cette présentation avec de très belles images qui vraiment retient l'attention. Vous êtes revenu sur l'importance de la connexion qu'on doit avoir avec établir une cartographie de l'ensemble de ce public cible-là pour vraiment avoir une communication permanente avec ces derniers. Et aussi le sens de l'écoute. Oui, quand il faut bien communiquer, il faut savoir écouter aussi. Et c'est vraiment très pertinent. Et je pense que cette présentation va permettre à l'audience de quand même tirer le son de ce que vous aviez dit et de pouvoir faire une bonne communication en temps de crise en lien avec les maladies zoonotiques. Ainsi dit, nous avions passé en revue toutes les présentations de cette dernière session. Nous allions voir avec mes collègues, Dr. Tieble, est-ce qu'il y a des questions que certains participants ont posées pour que on puisse en tout cas les reverser à nos experts pour des éléments de réponse. Dr. Tieble, over to you. Y a-t-il des questions?
OK, merci beaucoup. Oui, OK, thank you very much. There are a few questions in the chat box, and start with the last presenter, Dr. Catherine Bertrand. And one of the question is, what are the criteria for getting employed at the WOHA for someone who is a veterinarian and so who really want to work on international organization? I think I would ask you probably, if you want to, you can comment it, but the focus should be on risk assessment, risk communication, and colleague tailor really very well your question, because some of these questions, I think they might not be appropriate on this platform. And that was something to address. But if you want, you can address it. And I will go to Rodrigue. There was a question to Rodrigue as well. And Catherine, I'll come back to you about the stakeholder. Colleague asked, what are the differences between audience and stakeholders? And maybe you can jump on that one, and then we can move to Rodrigue's question after. Over to you. Thank you.
Yeah, no, it was just in order to try to make a difference between your partners. When you are working in national authorities, for example, you have the Ministry of Agriculture, the Ministry of Health, and in the One Health context, you need to work together. So it's what I was mentioning as stakeholders, partners, okay? And then all of you have your audiences, so farmers, nurses, physicians that are in the field, to who you, and the general population also, to who you want to address your communication, okay? The one you want to inform about communication. It was the difference I tried to make, but my speech was more general than that, so so I hope it helps to understand a little bit. Okay.
Yeah. Okay. Thank you very much. I just got the request. The video was off when I was talking. Thank you very much, Dr. Catherine. I think this is clear enough. And colleague, audience, you can have an audience, but some of those can be member of can be stakeholders as well. For example, take diseases which address with zoonotic disease of farmers and villagers and community members. We are all we are all stakeholders. Now the stakeholders, you know, you have the stakes, the interests of each of them, like you fund a company which fund, they are stakeholders, but they will fund it because they will get a fund from somewhere else. So stakeholders are wide. We are all stakeholders for global health security. If you can take that message home, I think that will be fine. Thank you very much, Catherine. And yes, Rodrigue, there is a question which you were asked, and I will just pull out for your question. How do we, yeah.
Tieble, can I just say, so Rodrigue's had to catch a plane. He's had to leave the meeting. But if you could call the question out anyway, just so people can hear what the question was, that would be great, but he's not able to respond.
Maybe the answer will be in his presentation. I think we can leave him and we can move to the next one. I think, colleague, thank you very much, Dr. Hyacinthe. Thank you very much, Dr. Catherine, and colleague, thank you very much. And we have Dr. Mohamed Nour as well, and Rodrigue Barry, who is running to touch his plan.